Okay, I've assessed my patient to find a good vein, and I do my assessment without the tourniquet because I want to get an accurate description or a view of what the vessel size is. Once you put a tourniquet on, the vessel could blow up, could be a little bit puffed up, and you're kind of falsifying the size of it. And then when you take the tourniquet back off, it goes down to a tiny little thing. And you really want to know how big that vessel is, how much flow you're going to get around it, what the catheter vein ratio is. All right, so now that I'm about to prep him, put a tourniquet on, I've got my probe cover on. I'm going to clean right here. 30 seconds. You want to get it clean. Like you're drawing cultures off it, even if you aren't. And I'm probably getting a bigger area than I really need to, but let that dry for a bit. 30 seconds. I take a little bit of the gel and I put it kind of north of where I'm going to be. I'm not going to use all that necessarily. I don't want to drag it all into the field that I'm actually going to insert. Again, buttons are on the outside facing the head of the patient. I like to hold the needle with my thumb here and my finger here so that the catheter doesn't slide off and get kind of away from the needle tip. You got to remember that your catheter is a little further down from your needle tip. So when you see your needle tip go in, you always want to go a little bit further, make sure the catheter is actually in too, not just the needle tip. I'm going to take a little bit of the gel and just kind of pull it down to where I'm going to insert. I want to center this on the screen, make sure I'm bright enough, not too bright, that my depth is good. Okay, I want to be able to see that vessel really clear. If you don't see your target, you can't hit it. So I want it centered. Here's my center mark. Here's my center line. That lines up with that. So I want to get it right over the center. This is an easy target. My kid could get this one. I'm not bringing too much gel down to actually where I'm poking the needle in because I want to keep that still clean, right? So I'm going to put the needle about a couple millimeters behind the probe. And again, I want my probe, I anchor my finger down on his skin and I can move the probe back and forth, okay? But it's anchored, I'm holding it. I'm not pressing down, I'm not holding it way up here and compressing the vein. See how hard that would be to get into? That's even a little less hard. Look at that thing, it's twice as big of a target. So I want to hold down here at the neck and anchor it on the skin. So I have good probe control, okay? I'm going back and forth. This one, it's about a half a centimeter down to the vein. So I want to go fairly steep, but not super steep. I just want to make sure I have enough room left. Once I get into the vein, I have enough catheter length left to still get in there further, okay? So I just want to talk a little bit about angle of insertion because that's something a lot of people struggle with at first. If we're looking at, if I'm going to go for this vessel down here, that's kind of deep, that's about 2 centimeters down, right? The 2 mark. That one, I don't want to go at this angle because it's going to take me a long time to get there. I'm not going to have any catheter left over to get into the vein. So I try to keep the gel out of my insertion site. So I'm inserting a little bit further back from where the gel is. I'm going to go really steep on this one. Go down. And I don't know if you can see something wiggling there on the screen. If I can't see where my tip is, I'm going to angle 90 degrees to the angle of the catheter, right? And that's going to brighten up my tip a little bit. And you see how there's a down shadow on the screen right here? There's that kind of dark stuff kind of coming down. That shows there's something there. So if I keep going away from my insertion site toward the tip of the needle, I should eventually see something. And since I'm perpendicular to the angle of my needle, it should come up a little brighter on the screen. And there you go. You can see I actually went through the bottom a little bit there. Too steep, okay? See where my tip is and see how angling the probe 90 degrees to it makes it show up a little brighter. One of the hardest things is to find your needle tip, especially when you're way back up in here and you have no idea where you're at, right? You're in that no man's land between the skin surface and the vein. If you angle it like that and go back, you can find it a lot easier, okay? So I'm gonna get down to here. I'm gonna get into the vein. There I am. And then when you get to this point, you gotta level out. If you don't level out, you're gonna go through the bottom. So that's when I start dropping the back, leveling out, and inserting, almost like landing an airplane. See how I'm doing that? And if I get closer to the bottom, I could pull back, kind of pull back a little bit and reapproach, as long as you're not pulling out of the vein completely, but you're just pulling back enough to kind of get a different angle of approach. You just don't want to be dragging on the ocean floor, you know what I mean? I'm centered. First step in is needle in, and I'm going to stop and I'm going to try to find my needle tip. You see my needle tip right there on it's wiggling there. It's that white dot top left. That's my needle tip, okay? So before I go anywhere with my needle, I've stopped where my needle is, and I should be past all the nerve endings where the patient can't feel it anymore. I want to find that needle tip before I move anywhere with the needle. So move your probe, not your needle. Find your needle tip. There it is, okay? So now that I know where my needle tip is, I'm gonna leave the probe right where the needle tip is, where I can see it. And then I'm gonna move the needle up a little bit, probe up, needle, probe, needle, probe, needle, tiny micro movements. And all I'm doing is going needle up a tiny bit, probe up a tiny bit. And I can see the tip, and I can go back and you can see the bevel a little bit. There's two lines there, kind of. If I'm not sure, I can angle my probe out. If I go 90 degrees to the needle, to the angle of the needle, it should brighten it up a lot more. So if you're not sure where your needle tip is, angle your probe 90 degrees to it and go back and forth. See how you can see the white line kind of going up and down from the top of the skin down to the vein? That's your needle, but it's not your tip until you get to the end of it and you don't see anything anymore. You don't care about that. That's not your tip. That's not your tip. That's not your tip. That's your tip right there. Where if you go up any further, you stop seeing it. So you go up where you don't see it anymore and you go back, okay? I want to get it in the center of the vein. And then now that I'm in the center of the vein, if I don't level out, I'm going to bottom out. I'm going to hit the bottom of his vein. So I got to drop my needle a little bit, come back, find it, and advance. Go up and advance. And you're just kind of leveling out as you go, so you're not going to hit the bottom. I don't want to go down and get to the bottom of his vein, right? There's no reason to do that. Keep it right in the center. If you need to go left or right, moving it right, left, little adjustments to try to get it in the center. Up and down. Luckily, this vein is big enough that I have enough room to go around, okay? Once I'm in the center and I know I'm good, I've gone far enough in that I know plenty of my catheter is inside. I can drop my probe, and then I can advance my thing up, catheter up. And I can take the tourniquet off. I like to hold pressure above where the catheter is, retract my needle. There's no blood coming back because I have the vein compressed. Without touching anything, connect here, tighten it up, only touching kind of the wing there. Pull back a little bit, make sure I got good blood return, it flows good, it flushes good. She's a beaut. Most important thing, I think a lot of people don't realize when you're flushing, anytime you're using an IV, flush, pulsatile flush, and then right at the end, clamp it as you're flushing. That gets the blood out of the end of the catheter and keeps the blood out of the end of the catheter while you clamp it down. If you flush and you don't clamp it, or if you flush it and then wait and clamp it, blood tends to kind of come back in and then your catheter gets occluded, and that's why your IV goes bad quicker. I'm going to use this to get the gel off. Let that dry for a minute. Skin prep. If there's any chance, these dressings don't stick very great, especially when there's been gel on the skin. If there's any chance that dressing's not going to stick very good, use some skin prep. Pop that open. This is sterile inside, so you're not contaminating anything by wiping it on around there. Let that dry real good. Always label your sign and date your insertion. It's good to have on there, not just on the Epic documentation. I like a good piece down here to anchor that. Another one to kind of loop it. She's a beaut.